So, hospice care is really at a crossroads right now. You've got these powerful forces, everything from new government regulations to some really cool emerging tech, and they're all reshaping what end of life care is going to look like. In this explainer, we're going to unpack exactly what those changes are, and more importantly, what they mean for patients and for the providers on the ground.
And really, at the heart of this whole thing is one simple, deeply human question. What does it actually mean to have a good death? As we're about to see, this conversation isn't just about policies or profit margins. It's about dignity, it's about comfort, and it's about compassion.
All right, first up, let's dive into the new reality that hospice providers are facing every single day. They're kind of caught in this pivotal moment, trying to balance the way things have been done for years with a future that is just changing at an incredible pace.
To really get what's going on, you have to go back to the pandemic. For a few years, hospice care operated with a set of really flexible rules that were honestly essential for providing care during that time. Well, that era, it's over. And the snapback to pre-pandemic regulations is creating a very different and much tougher world for them to operate in.
So all of this has led to what a lot of folks in the industry are calling the policy cliff. We're talking about some pretty significant new regulatory hurdles that providers are suddenly having to deal with. So let's break down what that cliff actually looks like. Okay, so this timeline really shows us how we got to this point. During the COVID public health emergency, CMS, that's the Centers for Medicare and Medicaid Services, allowed telehealth for certain hospice visits. Congress then extended some of those flexibilities for a bit. But the key date, the one everyone's watching, is September 30th, 2025. That's when that telehealth flexibility is set to officially expire. And that safety net? It's about to get yanked away. And here is the single biggest change this creates. Until that deadline, recertifying a patient for hospice care could be done remotely over telehealth. But after September 30th, 2025, it must be done in person, face-to-face, by a physician or a nurse practitioner. Yeah, there's no wiggle room here. It's a hard and fast rule they're all going to have to figure out. And listen, this isn't just some small tweak to the paperwork. It creates this huge ripple effect. Think about it. For rural providers, a doctor or nurse might have to drive for hours just for a single visit. That creates massive staffing challenges. And if they can't make that visit happen, they risk falling out of compliance with the rules, which could mean they don't get reimbursed for care they've already provided. It's just a huge strain, operationally and financially. And on top of all that, there's another financial pressure point, something called the Medicare claims hold. Now, it's a standard procedure where Medicare just temporarily hits pause on payments to make sure everything's accurate after a rule change. But for a provider who's already stretched thin, even a short 10-day pause in cash flow can be another huge headache. Okay, so we've laid out some pretty big challenges, right? But the story doesn't stop there. These pressures are also sparking this incredible new wave of innovation. The industry isn't just standing by. It's actively searching for new ways to deliver compassionate and effective care, even in this tough new environment. Which, leads us to the big question. If the rules are getting stricter and the operational headaches are just piling up, where do you find the room to actually make things better for patients and their families? That's the puzzle everyone's trying to solve right now. And one of the big hurdles they've pinpointed is pretty surprising. According to industry consultants we looked at, a lack of urgency is a top reason why patients who really need hospice care don't get admitted quickly enough. These delays can really bog down the whole system, and way more importantly, they can impact the quality of care someone receives. So to tackle this, providers are getting creative with technology. For instance, some are using artificial intelligence to help families work through those really difficult decisions in advanced care planning. And others are using virtual reality to give patients these incredible experiences, like visiting a place they loved one last time, or just finding a quiet moment of peace. So all of this really brings us to our final section, where we look at the future and the core tension that seems to define it: the business of hospice versus the mission of compassionate care. How on earth do those two things coexist? A recent study that was published in Health Affairs really throws this tension into the spotlight. It dug into the different ownership models in hospice care and found some very telling differences in how they operate. It reveals a pretty clear split between focusing on profit and focusing on care. So let's just look at the numbers from that study, plain and simple. What it shows is that hospices backed by private equity firms tend to have higher profit margins. On the other hand, the other ownership models, they tend to spend more on direct patient care. The trade-off is right there in black and white.
The big takeaway here, the thing you really need to remember from this study, is this. Hospices owned by private equity firms are, on average, spending fewer dollars on direct patient care. And that finding is absolutely central to the whole debate about the future of this industry. So when you put it all together, you've got the regulatory cliff, the push for tech innovation, and these competing financial models, you start to see this picture emerge of a system at a true inflection point. The entire industry is really grappling with its own identity and ultimately its purpose. And so all of this leaves us with one last, really powerful question. In an era of tightening regulations, of powerful financial incentives, and rapid technological change, how do we protect the simple human mission at the heart of it all, helping people have a good, compassionate, and dignified death